my name is Luiza. I am a recent graduate from Duke. I graduated in May 2019, and I am part of the Hart Leadership Program. For this program, I am in Sao Paolo, Brazil, working with cervical cancer screening, the Calla scope, engaging in conversations about reproductive health, and also trying to form my own vision of an ethical leadership. I am originally from Brazil. I was raised in Rio de Janeiro, and one of the things that I started to realize from a young age were the health inequities that were surrounding me. So many people around me had had cervical cancer, cervical precancers, but these topics had never been raised as I was coming of age, and I really thought that I wish I had contact or familiarity and exposure to these conversations. And I'm trying to do community-based research, which means that I want to engage with stakeholders that are working directly with cervical cancer screening in Brazil as I develop my research project and get their input at every step of the way, and also with women who are going to be the ones directly affected by any intervention that I decide to develop. I think that one of the things that I have really been able to learn so far is how convoluted the public health system in Brazil is. Cervical cancer screening is free in Brazil because we have a public healthcare system. So that is really incredible, and it's why the paradigm of having women who are overscreened and underscreened is so worrisome, because it doesn't, like, financial burdens shouldn't be a question in the middle of this, which is what you usually assume, that women who have lower income wouldn't be accessing care. And maybe these women who have lower income, they aren't accessing care because either they live further away or there are other barriers that come in the way, but that's where we really need to step in and ask the right questions and talk to the right people and discover these spaces where we can reach these women so that we are making more informed decisions for policy in the near future and even long-term future of Brazil's healthcare. One of the things that I have found that is very interesting is the patient-doctor relationship and how it differs so much about the way that it is done in the US. So I remember being at a clinic and shadowing a physician, and the way that they hold the patient's hand sometimes during the exam, or will use silly and joyful ways of calling a vagina or a speculum to ease the tension in the room during that pelvic exam, really inspire me and really make me think about the ways in which we should be making technologies that are sensitive to these cultures, and that they are also being mindful of these small but very important ways that people relate to each other, and also thinking about how a technology like the Calla scope that allows a woman to explore her own body should come into play with this culture. And while this culture is amazing and beautiful, it's also important to recognize how taboo conversations about reproductive health are here. And so one of the things that I really want to engage during my time in Brazil are also with these conversations. And I think that in part, as I'm starting to form my vision of ethical leadership, which is one of the aspirations of the Hart Fellowship, I think that this is a really strong pillar. It is knowing that every interaction that you have the potential to change the way that people think, and you have also the potential to open their minds a little bit more. So I think that sometimes if you are able to come with an open heart and an open mind, that changes everything.